It's a great pleasure to greet you on behalf of UNAIDS and to provide opening remarks for this summit. A summit focused on innovation, stakeholder and community engagement, people-centered responses, and on building resilience. As we all know, the world is monitoring the progress towards ending AIDS as a public health threat by 2030, and we are nowhere near where we need to be. The latest data from UNAIDS shows that the decline in the number of new HIV infections has stagnated. We will miss the 2025 target unless treatment coverage is accelerated, unless effective prevention efforts are reinvigorated and innovations introduced, and also that the barriers to inclusion are removed. East and Southern Africa still has the greatest burden of HIV in the world, but also some of the greatest successes. We're very worried about the continued increasing epidemics in Latin America, Caribbean, Middle East, North Africa, Eastern Europe, Central Asia, as well as a concern about the uptick in Asia and Pacific, a region that had been doing so well. There has been great variation in achieving the testing and treatment cascade across regions and countries, but no region has achieved the 95-95-95 targets, nor the 90-90-90 targets. In particular, children remain far behind, and it's very concerning that only 52% of children living with HIV globally are on treatment, compared to 76% of adults. We are also lagging behind in achieving the prevention targets. While there was significant scale-up of PrEP in East and Southern Africa in recent years, other regions have not achieved the same. Therefore, we are still far behind the regional and global target of 10 million by 2025. Furthermore, we will not reach epidemic control without a focus on the societal enablers and community engagement. Failure to make progress on societal enablers will undermine the efforts to achieve the HIV service targets and will also result in additional AIDS-related deaths and new infections between 2021 and 2030. UNAIDS and IPAC have partnered on a series of controlling the HIV epidemic summits since 2012, where the objective has been to highlight innovations that can help us to achieve and sustain HIV epidemic control both at national and at subnational levels. Our joint initial focus back in 2012 was on integrating treatment as prevention and PrEP as the powerful tools to stem new HIV infections and avert AIDS-related deaths. Of course, we've come a long way since 2012, yet a myriad of factors, including the colliding pandemic of COVID-19, has caused the world to lose momentum. 8 short years from the deadline to achieve the Sustainable Development Goal 3.3, we need to identify and to integrate more innovations into the HIV response. Clearly, though, these innovations must be more than just biomedical in nature. Advocating and realizing health equity for all is critical. We have new innovations in PrEP and treatment. Long-acting injectables are going to make a big difference, but we'll need them rolled out as quickly as possible to the people who need them and at the right cost so they can be scaled up. It provides an opportunity of PrEP reaching communities that have not enjoyed the benefits to date, and it will make a whole different dynamic of people who may have wished to access it in the past, and also with treatment. Long-acting treatment opportunities will be great for the response. Another area that's really important, and an innovation since we started these back in 2012, is the U=U agenda. This is an amazing movement across the world of bringing hope to people, changing the dynamic and understanding. Undetectable equals untransmissible. If people can suppress the virus, stay treatment adherent, then they don't pass HIV sexually. This changes the dynamic on rights, on self-stigma, on how people see treatment, and it will encourage people into treatment much earlier. We must all move with this agenda of U=U, along with the other innovations. In conclusion, key actions to reach epidemic control and to get the response back on track include a new push for HIV prevention and the innovations that we mentioned, to realize human rights and gender equality, support community-led responses, and to ensure sufficient and sustainable financing for the HIV response. UNAIDS is happy to continue partnering with IAPAC to highlight innovations. And over the next 2 days, we hope to see that these innovations and ideas that you're all going to share will help countries accelerate their HIV response towards achieving epidemic control. And we wish you a successful summit and look forward to hearing the results and the ideas and the plans for implementation. Thank you very much.
This is UNAIDS.